Hello, my name is Ghania Kabbara and I'm a clinical psychologist here at American Wellness Center. This is Lara.
I'm Tyan. I'm a clinical psychologist as well at American Wellness Center, and actually we're both specialized in treating trauma.
All right. So recently we have noticed that we're receiving lots of patients being impacted by the worldwide conflict. So we decided today to make a video and talk about trauma. What is trauma, Lara?
Well, trauma actually is when an individual is shocked. All of a sudden, it's an event that he was not expecting that shocks him, and often we have at first two kind of reactions: so shock and denial. So obviously, we all have a healing possibility within us, but after a month, if the symptoms that I'm going to be talking about right now persist, obviously, then there is something to be done about that trauma. It does not resolve by itself. So the symptoms would be, most commonly, flashbacks, irritability, a change in our pattern in eating, sleeping, stuff like that. But it can even include somatic symptoms, such as headaches, etc. So most commonly, trauma is diagnosed with PTSD, post-traumatic syndrome disorder. Now, this is when we have been either life-threatened or someone has been life-threatened. You'll talk about that maybe later on. But we have another kind of trauma that comes from childhood that we call childhood trauma. I'm not going to discuss it further for now, but it's whenever we still remember some events, specific situation, and we still are impacted emotionally the same way it happened many years before.
Okay.
Ghania, would you like to talk to us about the vicarious trauma?
Okay, there's also something called vicarious trauma, which basically is, we also often hear our colleagues or friends telling us about their traumatic experiences and how much they are impacted by it, and sometimes because they're also emotionally quite still under the shock, they tend to also project or retell their story, narrate their story in a very amplified and emotional way. And so technically the vicarious trauma is a trauma that we take on as per hearing the stories of others or even watching the news or videos. So we are basically being impacted or traumatized by proxy, by another person's experience.
Which I've had many patients, by the way, now with the events talking to me about, so how traumatic the images are. So let's tackle the coping. How do we cope with it? So first of all, the first thing I've ever asked my patient to do is to stop or reduce to a maximum watching news, looking at those images, putting radio on if some still use radio. So all what reminds us of those images are not okay for us to watch and to listen to all the time.
Great. Another thing that I'd like to advise is, as well as always, make sure to engage in self-regulating activities such as yoga, relaxation, anything that actually makes you feel good. It doesn't have to be a very slow or boring thing. It could be an activity, a dancing activity, an outing with friends, anything, any going to the beach, anything that actually makes you feel good and kind of distract you from whatever is going on.
Another tip could be, so if we're really, really affected, so either by war, like it's happening right now, we can tend to engage in NGO activities. If you have a diagnosis for children, you can watch so many parents creating their own association, so being militant actually towards and very engaged in those activities.
You're right, because I actually have quite some patients where they report to feel helpless about the situation.
Absolutely.
They feel like they want to do something, and they feel like, especially those who are living here and they have families in the affected areas. So something, as you said, is getting involved in any humanitarian actions, doing something. They feel they can contribute by sending things or even attending forums and giving a hand somehow, so maybe feeling useful, basically.
So feeling back a bit in control of something that we're absolutely feeling helpless about.
Correct. We never say enough, but also, and you should also reach out to your friends and family when you're not okay. For sure, this is something that...
so use all of your support system. And finally, and most importantly, if all of those coping mechanisms have not worked enough, it's okay to seek help, like to call a therapist and to be able to come and to do some sessions in order to overcome whatever is too much to handle. And it's okay when it's too much to handle.
Okay. In other words, I'd like you to identify your emotions and assess yourself and check in with yourself how much you can actually take in what's happening, whether hearing the stories of your friends or colleagues or watching the news or images or any of these social medias, and see to which extent you're able to tolerate whatever you're seeing, and accordingly either stop completely or engage in an activity that will really make you feel better. All right.
Thank you very much for watching.
you.
Hope it has been useful. Thank
And
you,
helpful.
Ghania.
Thank
Yes.
you, Lara.
Okay.
Bye-bye. Take care.
Bye.